So there are lots of things that can create some kind of return on investment for those dollars that are spent. What are some of the benefits that accrue beyond that number that could help to defray that cost?
What we expect decreasing child poverty to do, what does it buy us, in essence, is what you're saying, is that it will improve their health. There's good evidence that reducing income poverty improves child health. That's a huge cost in this country. It will improve their academic performance and school success. There's a lot of evidence that that's the case. And that's another huge cost to this country. I think, as Christine said, if you fail academically, there's a cascade of things that happen. One of them is that you don't, it promotes intergenerational poverty without and becoming productive in society. It also improves child behavior and mental health, and therefore makes it less likely that they are involved in abnormal behavior as teenagers, and really decreases their interaction with the juvenile justice system and as adults with crime. So, and for all of that, there is good evidence, and that would be the payback. Productive children, academically sound children, behaviorally sound children, who then not only cost society a lot less for those reasons, but then, as Christine says, become true productive members of our society.
Health and education are intertwined. You cannot have one without the other. And poverty, we know that is really not good for people. It affects, from brain development to their health, to their well-being, and the stress on the parents. I think parents want to do the right thing. Parents love their kids, but it's hard with all the stress and all the rules to do the right thing. And I think it's really important to address this.
So my question is about political will. It strikes me that children have two major problems when it comes to commanding the attention of lawmakers. One is that they don't vote because they can't, and two is that poor children are usually living with poor adults. And while most people can be convinced to have a heart for children, there's a lot more resistance to using federal dollars to help adults climb out of poverty and their children as a result. So short of reducing the voting age from 18 years to 18 months, what
I'm going to use that.
what do you think practically we can do to make this a 2020 campaign issue, for example, or to command the attention of lawmakers?
So I'll talk first this time. Now, I don't think I can wear my National Academy of Science hat to talk about any strategies like this. So I'm taking off that hat, putting it down here, and just using my usual bald head, and perhaps to some degree my AP hat. But I do think that in the report, basically, we do want people to use the report, to be honest. I think we have an opportunity. Congress, every time I tell people that Congress actually commissioned us to do this report, they're always like, really? Congress commissioned you to do a report to reduce child poverty? So I actually don't, I'm an eternal optimist as a pediatrician, and I do believe there is an opportunity for Congress to act on this. They mostly paid for it, and they wanted us to come up with a plan. And I think it's our, and this is where I'm not wearing the NES hat, it's our job to advocate with our Congress people, both in the House and the Senate, to look at this report and make it happen. And other countries have done it. I hate to tell everybody how wonderful Canada is yet again, but in fact they did one of the major interventions that we're not recommending, but we're putting together in a package. So it can be done, there can be a will to do this. And I think, I agree with you, I think there are candidates who are gonna be running for president and for Congress, and we need to get them to either commit or not commit to some of the suggested packages and individual programs that we use.
I'll keep my hat on, my NSA hat on, because you don't want me to put my CWA hat on. The report clearly demonstrates that there's a link between child well-being and poverty. The report also clearly demonstrates that there are ways to reduce poverty that work. And so the ammunition to cut through the extent to which people get paralyzed by thinking that it's too big, too complex, which it is, it's big and it's complex, but there's enough ammunition in the report to say we can make a difference. And guess what? Others have. And guess what? We have too. And if you look at the measurements of child poverty pre-EITC and post an increase, so you have an EITC program that's been increased. If you look at what happens when you increase that program and see the impact it has on child well-being and on the poverty level, that in and of itself is ammunition to go.
And people don't make the connection. They don't think about kids and public policy as being interrelated. And when you bring those two together, when you talk to people, do you care about children's health? Do you care about Medicaid and CHIP? Do you care? Like CHIP was actually performed in a poll in 2017 as the #1 issue people had. So if you prompt it and you ask the question, people are all on our side. And so that's actually the fourth thing, which is a positive thing, which is the public's on our side if we can make them aware. So public awareness and like this report is huge, because I think the public would have no sense that the child poverty rate in this country is 62% higher than it is for adults. I don't think anybody would think that that was the case, but the data in this report, the recommendations, things like that are huge, and more reporting and information that gets to the public around it are important.
Questions, yes?
First, I just want to thank you guys so much for the work that you've done. I am also a pediatrician here in DC, and having grown up in poverty and being a beneficiary of a lot of the entitlement programs that you mentioned, it just does my heart good to see that there's such a focus. One of the reasons why I took time away from patient care to come here today was to be able to walk away with some action items outside of advocating on the federal level. How can we, as the foot soldiers in this fight against childhood poverty, go out like today and start making some moves so that we don't have to report out that our children are, with that just atrocious statistic. What can we do as of today?
So I have some thoughts, just, and I'm sure all of us do. I think, first thing is, we need to make new friends and keep the old. So we know that the congressional leaders in Congress that are coming in new, we need to get them, grab them, but we also need to keep the Danny Davis and the others kind of connected and figure out a way to move us forward in a connected way. I think that every organization has to decide what can it uniquely do. So at CWLA, we're working with our committee to figure out what's our game plan. What do we do? Because we're linking abuse and neglect and poverty together and trying to think about how do we figure this out. So I think that every single organization needs to take the report, read it. I would read the summary one, because the rest of unless you're really like me and like to stay up all night, I would read the summary one and really, really think about it and have conversations with the people that you work with and your stakeholders. What can we do to move this forward? Because that's the only way it's going to happen. We have to create the buzz. We have to do all the things to get people thinking that this is, or understanding that it's an issue, and stick to the point that we know what works. We can do it. Stop saying that it's impossible to do. So that's what I would suggest.
I think I'm now going to put on my AAP hat since you're a pediatrician. And I think, as you know, the AAP has taken on the issue of poverty and child health. It's one of its strategic priorities, and we had a policy in 2016 which promoted advocacy for a number of the programs that we talked about today. So I think as a pediatrician, you can get active in the AAP because the voice of 67,000 pediatricians is not nothing. And actually, what we did regarding the Affordable Care Act and Child Health Insurance Program in the last couple of years was joined together with other medical organizations. So I think as a physician, we not only have the power of our pediatricians, but we also have the power of our connections with internal medicine people, with psychiatrists, with osteopaths, with, of course, obstetricians and gynecologists, and together. And what was so heartening about those collaborations was they supported us on Child Health Plus enthusiastically. They got it, even though they are not taking care of children. So I think there's a community that you belong to that you can start working on right away.
And as the fourth pediatrician that has spoken, I will say that, there are some things that were identified now that work, and what some parents may not know. Helping them connect to those products that they are entitled to, that they can get now, in addition to trying to change the larger system.
Can I add one thing?
Yeah.
So especially, I think it's fantastic so many pediatricians are here. You also are in a context where states are driving a lot of these successes. So if you look at the programs that have been identified, child care, EITC, there are roles for states to lead, which also makes it easier at the federal level. Maryland expanded the EITC. They're looking at doing more. So to the extent you can get your organization connected and your people connected to those existing services and to push to expand them, it will be very successful and helpful here too.
Yeah, and then I'd love to add a couple things. So good segue from Jill, because there's the Child Poverty Reduction Act that's going to be reintroduced that Congressman Davis and Senator Casey have. The great thing about it is it sets a target. Your question about local levels, local communities can do the same, and NACO is doing a lot of work at the local level about really making poverty a target in their community. And so that can be a target at the national level, the state level, at the local level. So that's important. I would also say that the very fact that you as a pediatrician are here talking about child poverty is one of the reasons why I love Dr. Diaz's presentation. Is it's the bringing kids' issues are often seen in silos. Kids don't operate in silos. The whole child matters, and so the interrelationship and the understanding of people in the healthcare child health field to understand the effect of poverty and child abuse, and vice versa. Christine, who's a child welfare advocate, but she understands the interrelationship between all of that and poverty and healthcare. And so the breaking down silos is such a key thing, because as a community, if we all come together across silos, we're a powerful organization. If we're all in our silos, people split us up and kids get ignored. The third thing is, and I think I just wanted to highlight a very important recommendation of the report, which is the access to benefits. So it seems boring to work on that in the policy areas. There's legislation called express line enrollment. And basically, if you're enrolled in 2/3 of the kids in this country who are uninsured are eligible for Medicaid or CHIP. And many of them are in some other program. So we ask families to prove that they're poor again and again and again and again. And we have computers, so computers can talk to one another and say, oh, that family's actually at 87% of poverty. We know for a fact they're eligible for Medicaid or CHIP. So we really need to have them bring in 5,000 tons of documentation. And I just want to, as an aside, there's language in the president's budget about more documentation and barriers. We know that that's a huge problem and for access to benefits, and that's an important thing as well. And then last is, the raising awareness, I think, that at the local level is really important to this conversation.
Bruce, I just want to add that also using your story, your narrative, so that people see the faces and what can happen with the right help at the right time for people. Because you're here as a pediatrician. so any child can have that possibility. And sometimes people don't see the connection or the use of wrong narrative.
I just wanted to add something around the issue of place, you know, where people live, because one of the things that we found in the report is the significance of that. That certain states and the resources that they have are very different from the resources in other states. But on the flip side of that is the fact that there are states that are doing some pretty remarkable things that we can learn from. Whether they have changed the way they provide access for families, or whether they have expanded a state level program, where they have that flexibility. There, from a research perspective, there's a great opportunity for learning there. But the bottom line is, when you think about food deserts and health deserts and all these other deserts, they're out there and they're real for people. And we really do have to figure out how we make sure that as we develop policies and strategies, we're reaching into those kinds of locations. So it's reaching into those people also and bringing them into the conversation, which will make a big difference.
Thank you, guys.
Excuse me, talking about location, I'm a special education teacher up in Alaska. I really appreciate Dr. Diaz, what you had to say, and I know you asked my question. I mean, as a special ed teacher, our job is daunting, just as yours is. I see all these children. I've been teaching for 25 years in Alaska. And anyway, so I appreciate your efforts. I think we've got some programs in Alaska. I think we all can do better. I mean, I think that my job is I always say, I got to pull a rabbit out of the hat every day, you know, greeting these kids with a smile that have been sexually abused, physically abused. So thank you for your efforts, and I think we can all do better. We've got a program out there called No More Matsu. We live in the Matsu Borough. Anyway, thank you. I can take back some ideas, thoughts to connect with my community back in Alaska. Thank you.
Well, I would like to thank the panel for your incredible insights, and thank you all for coming out.